I want to welcome Dr. Laura Michaelis. She is Nora and Luke's aunt, as I mentioned, and she is the Armand J. Quick Professor of Medicine for Hematology and Oncology at the Medical College of Wisconsin, and she serves as the Chief of Hematology Oncology Division. Her clinical specialty is the treatment of acute and chronic leukemia, myelodysplastic syndromes, myeloproliferative neoplasms, bone marrow failure syndromes, and myeloid disorders. She graduated from Harvard Medical School in 2000 and then completed her internal medicine residency at Brigham and Women's Hospital in Boston, Massachusetts, and her fellowship at the University of Chicago. She's the co-chair of the National Cancer Institute Leukemia Steering Committee and a regular speaker nationally on therapies for these conditions. So welcome, Laura, and we will turn it over to you to help teach us a little bit about leukemia and lymphoma.
Oh, thank you so much. So first off, I want to really thank you guys for what you're doing. And I hope that by the end of this, you can sort of recognize a little bit about how important the research is that is funded by the work that the LLS does, and also how important the patient support is. And those are two of the main functions and missions of the LLS. I've been involved with the LLS as a board member. I've worked on their fundraisers in Wisconsin and in Chicago. So I'm really, and I've used the drugs that they've helped invent. I've taken care of patients that have lived because of the work of the LLS. So I can't say highly enough how much I want to encourage you to towards the goal that you guys are doing. And I'm just thrilled to be able to do a little bit of help with raising awareness, just like you guys are. So Nora and Carrie and I talked, and I thought maybe it would be helpful. And this may be a little review for everybody, but I thought it would be helpful for me to give just a little primer on blood cancers and maybe tell you guys the kind of things I tell patients when they're first diagnosed, how to think about a blood cancer, where it comes from, and just having a little bit of an encapsulated understanding might also give you guys some additional understanding of why we need more research and why not all cancers are the same, and blood cancers are different from a lot of cancers for those reasons. So I'm going to share some slides here. I'm a slide presenter, of course, like my sister-in-law is. And Luke, I'm going to let you tell me if I have this right. How does that look, Luke?
Looks good.
Okay, good. So like I said, this isn't going to be exhaustive. There's no quiz at the end, but I just wanted to tell you a little bit about what blood cancers are so we could start there. And blood cancers arise so it's always good to first start what's normal. And one of the most mysterious and interesting parts of the body is the hematopoietic system, which is just a fancy name for where the blood gets made, which is here in the middle of your bone marrow. And the bone marrow, you guys have eaten meat before, some of you, and you may be familiar that there's like hollow bones in the legs, in the middle of the chest. The sternum, for example, is hollow. The pelvis bone is hollow. And those are hollow because, like animals, we also have all our blood production happening there in the bone marrow. And you can think of the bone marrow like a garden, and it's filled with seeds, and those seeds are called stem cells. Now, these are not the stem cells that you hear about on the news. They cannot become a skin, they can't become hair, they can't become a fingernail. But these blood cells or blood stem cells throughout your entire life become your red blood cells, your platelets, and your white blood cells. And they do that because of hormone signals that come out of the body. And it's really interesting. The bone marrow is actually located, they think that the bone marrow is located inside of the bones because bone marrow is so sensitive to radiation. And they think that over time, the body evolved, the human body or all organisms that have bone marrow evolved to put the bone marrow as far away from the sunlight or causes of radiation, because we know radiation damages the bone marrow. And was one place to protect it. It's sort of an interesting theory. We won't know how to prove it for a while, but this is just another picture of that bone anatomy. The bone is not just filled with seeds like hematopoietic seeds that then go become your red cells, white cells, and your platelets. It's also filled with blood vessels. And one of the key things is that when people have leukemia, it starts in the bone marrow, but it often travels all over the body because the bone marrow and the blood vessels are sort of one and the same. They're all interconnected. Now, again, notably, in a healthy bone marrow and a healthy body, you're making red blood cells to carry oxygen. You're making white blood cells, and that's your immune system, the things that tells your body what's normal you and what's foreign, what infections. Do you have mono to fight off? Do you have COVID? Are there things that you need to fight? These are your immune systems. And then your platelets, which help your body clot. Keep your blood somewhere between the consistency of water and mayonnaise. Now, the immune system also lives in your lymph system, and your lymph includes your thymus, which is here, this large system of lymph vessels all over your body, which have these little nodes, kind of like information gathering areas, and they happen to be where your body is exposed to the outside world. So you breathe in through your nose and your mouth, and so there's a lot of lymph nodes around your mouth and down your throat. You sometimes have lymph nodes near your rectum and near your urinary system because that's exposed to the outside. You have lymph nodes near your lungs because your air goes in there. And you have lymph nodes close to the skin at times. You also have a couple of organs, the spleen and the liver, that also help fight infection. And so these things, the bone marrow and the lymph system, are where blood cancers arise. And it's not like a breast cancer or a prostate cancer or a pancreatic cancer, which starts in one place. These are often throughout your body at the time of diagnosis. So what does the bone marrow do? Well, like I said, you start out with a stem cell, and then over time, within the bone marrow, these seeds grow up to become what we call myeloid cells and lymphoid cells, and eventually your immune system, which is made up of here, your red blood cells and your platelets. And it goes through a very elaborate choreography that's very precisely timed and needs to occur for the entire lifespan of the organism. So if you're going to live to 83 years old, those stem cells that you're born with need to make your blood and your platelets and your immune system for your entire life. And it needs to make more immune cells. It needs to make more stem cells. So this whole system needs to be kept pretty pristine and needs to work for you to have blood and blood production. And over the course of your life, the bone marrow keeps your immune system working. It makes sure you don't develop autoimmune diseases like lupus or rheumatoid arthritis. Your bone marrow needs to fight infection. It needs to prevent bleeding, and it needs to prevent blood clotting. And perhaps most importantly, it needs those red blood cells to allow oxygen to circulate throughout your body, to your brain and your kidneys, to your hands and your feet. And you have to keep creating the blood and stem cells for the whole life of the organism. Well, you can imagine something that's this complicated. If you had a garden and you planted a single seed and you expected that garden for 83 years to grow pineapples and grow, I don't know, basil and grow pumpkins from that single seed, there'd be a lot of complex DNA in that seed that would allow that kind of flexibility in growth and that kind of differentiation to occur. And it needs to occur for a long period of time. So, as you can imagine, things can go wrong. So, the fundamental things that cause blood cancer are when problems go wrong in this process. And the first problem that goes wrong is that the cells don't become mature. And we call that a failure to differentiate. So the stem cells might come to this point, for example, but then there's some sort of mistake that happens in the genes. And that mistake gets passed on to the next stem cell and the next one and the one after that. And pretty soon, none of these stem cells are growing up to become platelets or red blood cells or mature infection fighting cells. And that's called a failure to differentiate. And that means that the cells are kind of stalled out at an early stage. And the bone marrow fills up with these stalled out cells, and the blood becomes deficient in the cells that it needs. Another thing that can happen is the cells don't die normally. So when your body makes adult cells, grown-up cells like lymphocytes or monocytes, they have a life expectancy. They need to go out, do their job, and then die off. And if they don't die off, pretty soon they start to accumulate. The number starts to going up. And so one thing that can happen in blood cancers is that there's some error in the instruction programming, the DNA here or the DNA here, and the cells grow up, they become mature, but they never die. And so the amount of cells just keeps going and going and going because the cells forget to turn themselves off. And then the last fundamental cause of blood cancers is that cells that ought to be quiet and not reproduce begin to reproduce inappropriately. And so a cell that normally should reproduce once every 24 hours, or a cell that ought to reproduce once every 2 weeks, starts reproducing once every minute, once every 2 minutes. And then what happens is all the baby cells, they have those same instructions as the mistaken grown-up cells. So all those baby cells are now reproducing every 2 minutes or every 5 minutes instead of once every 2 weeks. And so you can imagine if cells are not maturing, so they end up being immature cells, if they don't die or they learn how to reproduce too quickly, then all of a sudden you've got a group of cells within the bone marrow that are not working correctly, almost like weeds in a garden. So what does that mean? Well, the first thing it means is that that bone marrow, which should be just filled with nice, healthy red cells, all of a sudden gets filled with 5% or 10% or 20% or 40% or 90% of abnormal weeds. And those weeds steal the resources, they confiscate the territory, they release chemicals that make you feel sick, like get you fevers and night sweats. And they make you feel very tired because you're not making enough oxygen or red cells to carry your oxygen. They give you bleeding and bruising. And you can sort of think about it like I do of weeds in a garden, and you can see it when you look in the blood. So this is a cartoon. Normally, your peripheral blood has lots of different kinds of cells, red cells and platelets and normal infection fighting cells like monocytes or neutrophils. But in leukemia, these immature, non-dying, constantly proliferating cells start to take over. Sort of like, as I said, like weeds in a garden, or one of my colleagues says they're like zombies that come out. They don't work, they steal resources, sometimes they kill other cells. And that is the disease of leukemia. And this is these bad cells, that's the tumor. It's not a mass that grows somewhere, but it's these bad cells that circulate throughout your blood system. And it's not just cartoons that you can see it. You can see it. Here's a picture of normal bone marrow, and here's a picture of bone marrow where acute leukemia is. So instead of having this good combination of different kinds of cells, it's all taken over by these leukemia cells, these immature, constantly proliferating, non-dying cells. And when you look at it in the peripheral blood, you can see those cells. This is an example of a patient with acute leukemia, and this is what the red cells look like. And this is what the white blood cells should look like. And these are what the immature leukemia cells look like. It has this big nucleus, which gives it instructions to proliferate over and over again. And it doesn't do its job. It doesn't have any proteins in there to do the normal infection fighting job. This is another picture, again, of acute leukemia with these huge cells instead of the normal cells taking over the bone marrow, co-opting and hijacking the bone marrow and the peripheral blood. So you can imagine if this is what your bone marrow is supposed to do, and when it's hijacked by leukemia, your immune system doesn't work well, you can't fight infection, you can have bleeding, you can have clotting, and you can feel very tired because there's a lot less blood to circulate around your body carrying oxygen. And that's what gives you the symptoms of blood cancer: anemia, easy bruising and bleeding, swollen glands or lymph nodes. So when we think about leukemia, we think about the disease being in the blood. When we think about lymphoma, you have the same sort of process that may not start in the bone marrow, but instead starts in the lymph nodes throughout the body. Those same cells, those same abnormal cells can give off chemicals that cause you to feel like you're sick. You can have night sweats and very much fatigue. People sometimes have fevers or unexplained weight loss, and they are very vulnerable to infection. And it turns out that people with blood cancer often can die of infection as one of the #1 causes of death, even though if their blood was normal, they wouldn't necessarily have that problem. So there's lots of different kinds of blood cancers, but 3 main groups. The first is leukemia, like I talked about, where most of the cancer, the bad cells, are in the blood or the bone marrow. There's lymphoma, where a healthy lymph tissue or one of our infection fighting nodes is taken over by the abnormal lymph cells. And these two are sort of cousins. And then there's this third very common form of blood cancer called myeloma, where the bone marrow produces abnormal blood cells called plasma cells, and they overproduce these proteins that can collect in the kidneys, it can collect in the bones, it can collect in the spleen or the skin, and it can cause people to be quite sick. It's in each of these conditions, leukemia, lymphoma, and myeloma, there's some times where it's very aggressive. We call those acute or aggressive. And there's sometimes where it's very slow growing, where people can have it for years and not know. But each of these categories has multiple subtypes of blood cancer underneath them. So, like I said, the Leukemia and Lymphoma Society is one of the oldest and most important patient advocacy and research societies that's helping to combat leukemia and lymphoma. And they're doing that by finding out more about the diseases, by funding basic research. They not only fund research on sorry about this, or on why these diseases happen, and that's sort of basic research, but they also fund development of treatments, new pills, new IV treatments to help get rid of the cancers or to target cancer cells instead of the normal stem cells. And then one of the most expensive things about treating cancer is developing the kind of clinical trials that are necessary to prove that the treatments work. And the Leukemia and Lymphoma Society is running one of the largest leukemia studies in the world right now. It's called Beat AML, to try and prove some of the newest treatments out there work in patients, not just children, not just middle-aged people, but older people too. The other really important thing that the Leukemia and Lymphoma Society does is it raises awareness, of course, but it helps understand what are the barriers to patients getting care. Do patients not have access to care because of financial concerns? Do they not have access to care because they don't understand the diseases well enough and understand how they need to be treated? Do they live in parts of the country where they don't have access to the kind of doctors that treat these very rare conditions? There's hundreds of thousands of people in the US diagnosed with lung cancer and breast cancer, but there's less than 20,000 diagnosed with leukemia this year. So it's a relatively rare cancer. And finally, the Leukemia Lymphoma Society provides both logistical and financial support. And that's all part of their mission to cure blood cancer and improve the quality of life for patients. So I've been talking for a while. I'm going to stop sharing and open this up for questions. But I want to thank you for the chance to kind of talk a little bit about what blood cancers are and why the work you're doing is so important.
I'm sure Luke has a question.
You put him on the spot.
Luke,
Sure,
you always
I
have a question.
I can jump in.
Okay.
So, this is just a question about you, Laura. How long have you been working with the current organization that works with leukemia and lymphoma?
Yeah, so I started working with leukemia and lymphoma when I first became a specialist, which was when you go through medical school, you go through residency, and then you decide, do I want to be a specialist in internal medicine or a specialist in heart conditions or stomach conditions or kidney conditions? And I decided I wanted to be a cancer specialist. And I first met the Leukemia and Lymphoma Society people when I was doing my fellowship in hematology oncology at the University of Chicago. So that was in 2024. And I've been sort of tangentially working with them since that time. But it's only since I began taking care of patients that I really recognize the impact that they have.
Did you mean 2004 or 2014?
I meant 2004.
Yeah, Luke was one.
Okay, yeah, exactly.
It
I remember
wasn't
when
last
Luke was
year.
one. I remember when Luke was one.
Yeah. How about anybody else on the call? Anybody have questions that we can help ask of our resident expert in leukemia and lymphoma?
Not a question, but Laura, as a staff partner for the Leukemia Lymphoma Society, I do just want to thank you for sharing and just sharing cool things about you actually using the drugs that have been funded by LLS on patients that you see every day. I think that's a really big testament to that you guys are currently saving lives. It's not just things that are in the works. Like people and doctors like Laura are actively using it and what you guys are helping fund research for. So I think that was a really cool thing just to hear. Because I mean, we don't get to talk to many people who, and doctors specifically, that have partnered with us and been so involved with us in the past using our drugs. So I think that's a really cool thing just as a staff partner to be able to hear.
Absolutely, absolutely. I mean, for example, in the 1960s and 70s, a child that was diagnosed with leukemia had maybe a 10% chance of living. Because of the work that's been done, mostly in collaboration between academic hospitals and the Leukemia and Lymphoma Society and other patient groups, the life expectancy of a child diagnosed with acute lymphoblastic leukemia now is over 90%. So that means that 9 out of every 10 kids can be cured, whereas, and sometimes even more, maybe 9.5. And in the past, that was 1 out of every 10. And that's because of the types of therapies that have been developed with the LLS. And a lot, now we're getting to the point where we can even stop using some of the old-fashioned stuff and start using some of the new things, the pills. We have new ways to use people's own immune system to kill cancer cells. It's really remarkable. And there will be a time in the future where we don't need chemotherapy, where blood cancers will pretty much be able to be cured without any kind of the old-fashioned chemotherapy. And that's because of the research that's being done now.
Yeah, no, absolutely. And I hear so many stories about if a child is diagnosed with a cancer when they're young, sometimes chemo can then form leukemia in the future because of the treatment they're receiving and the harsh things that are being put on their body, because it's the same as like adults are receiving treatment for. So
Mhm.
praying for that future one day that they no longer have to receive it that way and we don't have to see that happen. But just thank you for hopping on and sharing so much
Absolutely.
incredible information. I feel like I learned so much through my job, but that just taught me so much more. So thank you for speaking
Well,
tonight.
thank you. Of course, I'm happy to. I'm inspired by you guys. The work you're doing is great, and I hope that with a little bit of background about this, it gives you a little bit more understanding of why it's important to raise this money and how you can really help change lives with
Absolutely.
each bit.
Thank you all for being here. Laura, safe travels back home. Thank you
Thanks,
for being here.
everybody.
Okay. Thanks
Love you,
all.
Laura. Bye-bye.
Love you too.
Bye.
Love you too. Bye.
Bye.